If you're sick of flushing money down the drain on miracle creams while your skin continues to age, I want you to listen up. I'm going to break down the top 5 science-backed strategies and the honest risks you need to actually slow skin aging. Let's go. So your skin is like a fortress wall under a constant siege. UVA, UVB, pollution, free radicals, stress hormones, they're all chipping away at collagen and elastin, creating cracks you know as wrinkles, sagging, and dark spots. Genetics and time set the baseline, but up to 80% of what you see in the mirror is extrinsic, meaning it's driven by your daily choices. So if you want to age on your own terms, you need a 5-pronged approach. Sunblock is your shield, retinoids is your remodelers, antioxidants as your protectors, lifestyle as your fuel, and clinical procedures as your power boost. Nail each one and you're not just delaying wrinkles, you're rebuilding your skin's resilience. Pull one thread, the whole system weakens. So today we're not only listing the strategies, we're digging into the real-world risks and trade-offs you need to navigate so you can make smart, science-driven decisions. Number 1, daily broad-spectrum sunscreen. So why does it work? UVA rays dive deep, breaking down collagen. UVB burns the surface, driving pigmentation. Both generate reactive oxygen species that shred DNA. A 4.5-year Australian randomized trial of 903 participants with a mean age of 39 years old found daily SPF 15 use cut photoaging signs by about 24% versus occasional users. The decade-long sunscreen and prevention of skin aging trial showed daily broad-spectrum use left people looking nearly 10 years younger in extrinsic aging. So how to apply? SPF 30 broad-spectrum, at least a nickel-sized dollop for face and neck. Reapply every 2 hours outdoors, every 4 hours indoors or near windows. And you want to layer under makeup or over vitamin C in the morning. So what are the risks and considerations? So first, the chemical filter concerns. Things like oxybenzone, avobenzone, octinoxate, common UV filters can trigger contact dermatitis and photoallergic reactions in sensitive skin. And low-level systemic absorption has raised endocrine disruption questions in some animal studies. So if you're wary, you want to switch to non-nano zinc oxide or titanium dioxide mineral sunscreens. What about the environmental impact? Chemical sunscreens contribute to coral bleaching and aquatic toxicity. Reef-safe, fragrance-free mineral options protect you and the planet. And lastly, the vitamin D trade-off. Blocking UVB reduces cutaneous vitamin D synthesis. So you want to aim for brief, 5 to 15-minute unprotected morning or late afternoon sun exposures a few times weekly. Then switch to sunscreen. Plus consider dietary vitamin D or supplements if you live up north or have darker skin. Strategy number 2, topical retinoids. So why does it work? Retinoids bind to nuclear retinoic acid receptors, accelerating the keratinocyte turnover, boosting collagen 1 and 3 synthesis, and inhibiting matrix metalloproteinases that degrade dermal scaffolding. And in a 6-month double-blind randomized control trial, they show that 0.05% tretinoin significantly reduced fine lines, hyperpigmentation, and roughness. And a landmark 1993 New England Journal of Medicine histology study demonstrated restoration of collagen 1 in photodamaged skin. So how do you use it? You want to cleanse and dry your face. Apply a pea-sized amount of tretinoin every other night for 2 weeks. Increase to nightly as tolerated. You want to follow with a rich ceramide-based moisturizer and always wear sunscreen the next day. And what are the risks and considerations? So first, the retinization phase. Expect 2 to 6 weeks of redness, peeling, dryness, and occasional stinging. This indicates your skin is purging and rebooting. Also photosensitivity. Retinoids thin the stratum corneum temporarily and increase UV sensitivity. Skipping sunscreen can exacerbate irritation and photo damage. Also irritation management. If skin gets flaky or raw, cut back to 2 to 3 times per week. Buffer with moisturizer or switch to lower strength retinol or retinaldehyde before graduating to tretinoin. And contraindications, avoid during pregnancy and while breastfeeding. And those with eczema or rosacea should definitely proceed only under dermatologic supervision. And strategy 3, topical antioxidants. So why does it work? Antioxidants neutralize free radicals, those rogue oxygen species that oxidize lipids, proteins, and DNA. L-ascorbic acid, or vitamin C, upregulates collagen synthesis and inhibits tyrosinase, reducing pigmentation. And niacinamide strengthens the barrier via ceramide production and blocks melanosome transfer. In a 2022 systematic review, they confirmed vitamin C serums improved texture and brightness within 8 to 12 weeks. And split-face trials of 10% L-ascorbic acid showed significant wrinkle and spot reduction in just 8 weeks. So how do you layer it? First thing in the morning. After you cleanse, you want to apply 10 to 20% vitamin C, followed by 5 to 10% niacinamide, then a moisturizer, then sunscreen. And in the evening, you want to cleanse, followed by retinoid, followed by niacinamide, and then a moisturizer. And what are the risks and considerations? Formulation stability. L-ascorbic acid oxidizes quickly. Once a serum turns yellow, it's inert. Store in a cool, dark spot and use within 3 months of opening. And additionally, the irritation potential. So high-strength vitamin C, greater than 20%, can sting, especially on compromised or dry skin. So you want to start at 5 to 10%, then build up. And what about pH mismatches? Vitamin C requires low pH. Niacinamide prefers near neutral. Layering improperly can reduce efficacy or increase flushing. Always apply vitamin C first, let it absorb, then niacinamide. And as far as synergy caution, combinations like C plus E plus ferulic acid offer enhanced photoprotection, but can escalate irritation. If you're sensitive, introduce one active at a time. Strategy 4, lifestyle modifications. So why does it work? Your skin reflects your internal environment. Things like diet, toxins, repair cycles, and hormones all funnel down to cellular turnover, collagen integrity, and barrier function. So diet and glycation. High sugar intake creates advanced glycation end products, or AGEs, that stiffen collagen and elastin. In a +1 cohort of over 6,000 individuals, they showed a high monosaturated fat intake, so things like olive oil and fatty fish, cut severe photoaging odds by roughly 30 to 40%. Nearly 3,000 Dutch women on a Mediterranean-style diet had significantly fewer wrinkles. Next up, smoking cessation. Smoking raises matrix metalloproteinases and constricts microvasculature. A meta-analysis of 15 studies from 2005 to 2023 found smokers exhibit more wrinkles, thinning, and poor tone. Quitters see improved color uniformity and reduced redness within a month. Next, sleep quality. Under 6 hours per night correlates with thinner skin and deeper lines in observational cohorts. Growth hormone peaks during deep sleep, driving nightly repair. And lastly, stress management. Chronic cortisol upregulation breaks down collagen and drives inflammation. Simple mindfulness or 10-minute breathing exercise lower cortisol and preserve dermal integrity. And what about the implementations and risks? So diet pitfalls. Crash diets or extreme restriction can starve your skin of essential fatty acids and micronutrients. Aim for balanced macros rich in antioxidants. Smoking relapse. Nicotine replacement therapies or behavioral counseling can help, but be mindful that withdrawal-related stress may transiently spike cortisol. Counter with meditation or light exercise. And sleep aids, over-reliance on sedatives can disrupt sleep architecture, so you want to prioritize sleep hygiene first. Dark, cool room, device curfew, consistent schedule. And lastly, over-meditation. Excessive stress practices without guidance can paradoxically increase anxiety in some individuals. Find an approach that fits your personality. And strategy 5, procedural collagen induction therapies. So why does it work? Controlled wound healing kicks off potent remodeling cascades, upregulating TGF-beta, collagen 1 and 3, elastin, and angiogenesis. So first is microneedling. In a clinical cosmetic investigative dermatology study in 2011, they reported a 140% bump in epidermal thickness after only 8 weeks of microneedling, plus topical vitamins A and C. A 2020 randomized control trial found 4 monthly motorized sessions significantly improved firmness, hydration, and smoothness under the VISA imaging. And how about fractional lasers? CO2 and erbium lasers create microthermal zones. One study noted 30 to 6% wrinkle depth reduction in 1 to 3 sessions. And lastly, radiofrequency microneedling. This delivers heat energy at specific depths, with 2 to 3 sessions yielding noticeable lift and textural improvement with minimal downtime. So what are the procedural protocols? You want 2 to 4 sessions spaced 4 to 6 weeks apart. As far as downtime, microneedling, 24 to 48 hours of redness, fractional lasers, up to 5 to 7 days of peeling, and RF, 1 to 2 days of mild swelling. And post-procedure, apply growth factors, peptides, or vitamin C to boost results by up to 30%. And what are the risks and considerations? So first is infection or hyperpigmentation. Poor asepsis or aggressive settings can cause bacterial infection or post-inflammatory hyperpigmentation, especially in darker skin types. Always use a board-certified provider. Additionally, cost and accessibility. These procedures can run hundreds to thousands per session. Budget accordingly and consider ROI versus at-home routines. And in terms of pain and discomfort, topical anesthetics can help, but expect some stinging or heat. Plan recovery days. And lastly, rare complications. Scarring, paradoxical fat loss, or lipoatrophy with lasers. Discuss the risk profile in advance. So what are the final takeaways? First, sun shield with awareness. Brief unprotected sun for vitamin D, then broad spectrum SPF 30 chemical or ideally mineral sunscreens. Number 2, retinoid remodeling with patience. Embrace retinization. Buffer irritation, never skip sunscreen. Number 3, antioxidant protection with precision. Layer vitamin C, then niacinamide, and watch pH and stability. Fourth, lifestyle synergy, not sacrifice. Mediterranean diet, quit smoking, prioritize sleep, manage stress, avoid extremes. And number 5, procedural power-ups with caution. Microneedling, lasers, RF, they amplify collagen but factor in cost, downtime, and risks. Lock in all 5 pillars and the risk mitigation strategies for maximum durable impact on skin aging. No gimmicks, no shortcuts, just the full suite of evidence-backed tools and honest trade-offs. And as always, I hope you enjoyed this content. If so, if you want to hit like or subscribe or leave a comment, and I look forward to seeing you in the next one. Thank you.